What is pathophysiology? What is your understanding about it? Here we have the concept of pathophysiology. Pathophysiology may be defined as a physiology of disease. Disease is what is abnormal. It's physiology of disordered function or derangement of function seen in disease that is produced by the action of an etiologic agent. We call it being yuan ti in Chinese. You've started to learn medical Chinese, so it's better you learn more Chinese words. Therefore, you can understand the medical stuff in the hospital when you're doing your visitation and internship. Etiologic agents, 病原体, on susceptible tissues, the vulnerable tissues, 易感组织, or organs, 易感器官, susceptible organs, 易感器官. Pathophysiology introduces also the study of mechanism of underlying disease. Let's move on to the next interest is, why do we need to learn, to study, to do research about pathophysiology? What's the position of this subject in the whole range of medical career or medical course? Pathophysiology is working as an important subject, bridging basic sciences and clinical medicine. See, the left side of this bridge is basic sciences, and the right side is clinical medicine. You have to cross this bridge to understand what is the relationship between the basic and clinical factors. To join the two parts together, it's useless to do research only about theory and the practices. The reality is more important for us to treat patients with various kinds of diseases. And the main teaching contents. What are the main teaching contents? Let's have a look. The conspectus of disease. What is conspectus? Anyone understand? Conspectus. Anyone understand what's the meaning of conspectus? Conspectus of disease is the general concept of diseases and general etiology and pathophysiology of diseases. And fundamental pathological process is the common changes of function, metabolism, and structure occurred in the different diseases. For example, edema. So what's the process? Think about it. Maybe you don't know it yet, but after learning this subject in this semester, you will have a full understanding about why the water or the fluid in our body goes to the place where they don't belong to cause edema. See? And when you press on a tissue of an area where edema exists, we see a pit here. We call it pitting edema. See this patient, what problem she is suffering, and which part is having edema, and what the focal, or we call it local, symptoms of this edema tissue. Pay attention to her legs and pay attention to her faces. Are they suffering from the same type of edema? Keep this in your mind. Keep this question in your mind, please. this is another type of edema maybe you are not familiar with. This one is a excessive fluid building up in the abdominal cavity. What's the name of this? Ascites. And we can see this symptom from patients with cirrhosis. And systematic pathophysiology. Systemic: heart failure, respiratory failure, hepatic failure, liver problem, and renal kidney problems. These are all the contents we are going to learn. On the screen, that's how we are going to organize this semester. We're going to learn those chapters: Introduction, Conspectus of Disease, Acid-Base Imbalance, Fever, Stress, Edema, Disorder of Water-Salt Metabolism, Hypoxia. What is hypoxia? Less of oxygen. DIC. DIC is the abbreviation of, here is a question for you. And shock, ischemic, reperfusion injury, respiratory failure, heart failure, hepatic failure, renal failure. Okay, we have done the introduction, and let's move